Hey folks, I'm your host, BKP. I am glad to be back with these two doctors this morning, Dr. Raymond Tidman, Dr. William Whaley, and we also want to thank Georgia Cancer Specialists affiliated with Northside Cancer Center for this segment every Friday morning called Ask the Doc, where we take your questions and Dr. Whaley goes through them, charts, graphs. I mean, I've watched people attempt to answer medical questions, and very good physicians. But when you get a question, I mean, we break this down. You send 19 emails, you got charts, you got graphs, you answer the question. Okay, I got to get right. I mean,
I'm taking some criticism, that my mother and father used to say, you ask Bill Whaley what time it is, and he tells you how to build a watch. So sometimes I think I go too far. But I did get a.
We'll just take.
All right, I'm gonna tell you. I'm not talking about a tie today. By the way, we got the truck out there. It's beautifully and sunshiny. But why are we at Circuit World? Because it's beautiful and sunshiny and 40 degrees out there.
Something you just said there, Bill, really struck a chord with me. I think one of our issues with the CDC all this time has been this rule maker that's unyielding and uncorrecting. And one of the things that you do in this program that I think I do in my practice is I try to teach the people the why, and they figure out the how. And so when you approach a lot of medicine that way, where you're just saying to the patient, look, this is why I recommend this, and this is why I've come to these thoughts. They're smart enough to figure out how they want to deal with that. Or if you said, look, here's how the virus, as we understand it, moves through people. They will figure out how to avoid the virus. But when you say, well, you put this mask on and you wear it in your car, they're just doing what they're told. They don't get any smarter from that. And I think that's one of the things that I think is good about the program, but also a good way to deal with folks.
We're making them smarter. Right?
Yeah. Well, anyway, I
gotta get back. Go ahead.
I was going to say, there's been a lot going on this week. So what say you? Just in general, what say you?
Well, number one, I'm wearing this instead of a tie today.
Yes.
For a specific reason. I told you, I got a phone call yesterday asking me to comment this morning about physician and health professional burnout through this COVID epidemic, and the fact that cancer is being later diagnosed, and we're actually seeing patients in a more advanced stage now than we did a year ago. When the teachers, and this is not supposed to be political, came out yesterday and said the teachers have been so stressed and have so much stress by staying home and looking at the computer that maybe they ought to go back to school. So my point is, you heard it first on FetchYourNews, March, April, May of last year, we said, let the kids go to school. Let the kids go to school. Well, you heard it here first. I had my second COVID vaccination on January the 6th. Ray had his about 3 or 4 weeks later, and we told you at that point, this mask is not protecting me from anything or you from anything, and we're only wearing it out there so people don't think that we're antisocial or anything. And so for a year and a half, I've had a mask hanging from this thing. If we could burn it, I'd have burned it this morning. So that's all I got to say about that.
Got a match?
So Dr. Willie has thrown, officially right here, folks, we can report Dr. Willie has thrown his mask away.
Yes. Now, you ready to go to work?
Ready.
This first question is a PCP question. And the second question, I actually talked to this guy in China. Okay. Now, my father, this really comes back to what we've been talking about, people not going to the doctor. My father had not seen a doctor in 20 years and went on Medicare. Now we hear this up here all the time. Mm-hmm. Saw a PCP and had an elevated white blood cell count. The hematologist, that means PCP, sent him to a hematologist, diagnosed stage 0 chronic lymphocytic leukemia and said he should be treated with watchful waiting. Well, now we've talked about CLL a dozen times up here, and that's you're not sick, right? This guy had seen a doctor 20 years. He got Medicare, so he goes in for a physical. So he's not sick. If he hadn't gotten Medicare, he would not be in the hematologist's office, would he?
Oh.
He'd be well. Okay, so that's why watchful waiting is what you do for him. He's probably had it for 10 years, and he's been watchfully waiting at home because it wasn't diagnosed. Both the PCP and the hematologists are more worried about his weight and possible sleep apnea and possible heart disease than his leukemia. Does that make sense to you?
But that's a very interesting question.
Well written, wasn't it?
Yeah, that's a very interesting question because I don't know why you wouldn't be as concerned with all of them, but
Well, you're going to give a little CLL thing here?
Yeah, well, what I'm going to I'm going to give an obstructive sleep apnea thing here. Okay, CLL. Remember this now. The guy was not sick. He went to the doctor because he got Medicare. The PCP sent him to a hematologist, but noted that PCP noted this guy's probably got sleep apnea and heart disease. So after the PCP got the word from the hematologist that stage 0 chronic lymphocytic leukemia, send him back to me in 3 months and I'll do another blood count, the PCP is worried about obstructive sleep apnea. So I just want to read one brief. Sleep apnea is, it's everywhere. Overweight people who snore. Let's just begin with that. 19% of patients with, this is a study of people with severe sleep apnea versus overweight people who snore that are not have sleep apnea. Okay, so you've got a equal population in terms of biology, and they both snore. 19% of participants with sleep apnea died over the course of a 3-year period of study, with 4% of participants who had no sleep apnea. That's a huge difference, 19 versus 4. Now, these are older people with other comorbid conditions, and so the 4 that died of something else, they had a heart attack or their wife shot them or something. So that's a pretty...
It could happen.
Well, yeah,
I know, but
let's go back. When you're doing a study, when he's doing a study, once somebody goes on clinical trial for cancer, all deaths are considered deaths. So a car wreck death's a death on study. A husband who gets shot by his wife died on the trial, and if he's on the placebo versus the chemo, or on the chemo versus a placebo, he's counted as a death. Well, that's why this COVID death thing we've been on before has got statistical issues in it. People died with it, but not from it. Okay, show that first picture. I'm quite familiar with sleep apnea. I'm practicing for 50-something years, and there are people who are lean and thin that have sleep apnea, but the majority, like Ray, but the majority are overweight. You got that picture up there? So this is what sleep apnea is. Generally when you have a lean neck, you've got a gristle around your neck here that karate chop on the TV, and the guy gets is disabled from it. That's because you bruise inside a gristle and it can't get any tighter, and that blood shuts off your blood supply and it kills you. But what happens in this is that mostly when you're overweight and you're lying on your back, the tongue falls back, the upper jaw slacks, and then you've got an obstruction there, so it's like you got a balloon and you're putting like that and letting the air come out of it. That's where the snore comes from. Pull that down, okay? Well, when that happens and that thing falls back in there like that, then you stop breathing. Well, that ain't good, You stop breathing, you can die, can't you? So what happens there most often is you get an arrhythmia. After about 10, 15 seconds, your brain tells you that you don't have any oxygen and it cranks you back up again. Or your husband turns you over to your side, okay? So put up the next one. If you just take overall mortality of people who've got all of these disorders, you got that chart up there? So overall mortality versus sleep apnea, the high end of that curve, you can pull it down now, is patients with sleep apnea. That's a graphic of what I just read to you. Now, how do you treat it? Put up that next treatment one, and we'll look at this briefly, and then we're going to get off of it. You see, you got that up there? All right, so there's all kinds of ways to treat sleep apnea. You can pull it down if you want. There's central sleep apnea. That's not obstruction. Most of it's obstructive sleep apnea, like I just taught you. And there are lots of ads on the radio from dentists who want to make you a thing that pulls your jaw out like that. And that, what percentage of people that work for, Ray?
Less than 1.
Well, don't give them that fancy. Less than 1, let's say 5. But basically, that's a real moneymaker for the dentist. And it doesn't really treat obstructive sleep apnea. It might help somebody who's snoring that doesn't have obstructive sleep apnea. So you got that down now, right? You don't need it up there anymore. There's a device. There's various ones that CPAP mask. It's way past what I know anything about. But there's ways that you put something on here that gets pressure so that it keeps that air flowing. And people, when they put it on there, say, my gosh, it's the best thing ever happened to me. I wake up refreshed. I'm not tired. I don't fall asleep in the middle of the afternoon. Right?
Absolutely. So let me round out a few things here. Sleep apnea, diabetes, hypertension, cardiovascular disease, overweight. All those things go together as one big package. And as one big package, they are shortening probably more lives than anything. Just that big package. They don't, I don't have patients with just high blood pressure most of the time. I've got high blood pressure in diabetic or high blood pressure in overweight. The sleep apnea is the hardest thing to find because unless you have a witness, unless you have the wife in there with him or vice versa, and they say, he scares me. Like, he quits breathing, and I feel like I got to shake him. So he's not going to tell me that, or she. So, you have to look for an elevation in their hemoglobin. You look for their blood pressure is really hard to control. You look that they're struggling with weight loss. All these other things indirectly point to sleep apnea. The other big pointer is, and this is for some folks who've given up, the diagnosis is now a lot easier. We can have a test sent out to the house. Strap goes around your chest, looks at your breathing, pulse ox on your finger, a couple leads from an EKG, and a little thing under your nose that looks at your CO2 levels. And in your own house, in your own bed, we can screen you and see if you need a full test.
A lot cheaper than the old.
A lot cheaper than, I used to kid my patients. I'm like, okay, you're going to go in there, they're going to put 20,000 wires on you and lay you down in a bed with a camera on you, and they're going to be in a window up there, and they're going to tell you to go to sleep. It's not very restful to me, so I never could figure out how that worked. But the home test is pretty easy. That test will say, hey, I need to get real serious about this because I very well will have sleep apnea. The other side of the equation is when the diagnosis is made and the family practice doctor or pulmonologist or internist, whenever they say, hey, you've got it, we got to treat it, and this is personal experience, you need to go through enough trials of the mask that Bill talked about till you find one you can wear.
One.
Yeah.
All right, stop right there a minute. Show my graph. So there, Ray's talking about the people that get treated and get a mask that fits, get the thing done, versus this is the people that got treated, got diagnosed, and inconsistently wore their mask. Remember, Justice Scalia, pull it down, is said to have died the one day he left his CPAP mask in the trunk of his car. Now, my wife says he was killed by somebody. So
probably, I knew that was coming. So.
But anyhow, so that's the issue with sleep apnea. So let's go back to the question, all right? The question is, they're more worried about possible heart disease, so Ray just said obesity, diabetes, and hypertension, than his leukemia. Does that make sense to you? Obviously it does. This sleep apnea is not a joke. All right. We're going to get this next one because it's interesting, and I want to say something good about it because I have actually talked to this patient.
Before we move to that one, give me just a second.
All right,
I want to ask you really quickly.
You're the moderator of my program.
Well, I want to ask you because I'm listening. So what's the difference? And is it okay if you just snore? If you just snore, what's the difference? And you may have already answered it, but I want to go at it a different way. What's the clear difference between just snoring at night and sleep apnea?
There's no difference until you have been tested. And so when somebody says, my husband shakes the house and I live in another bedroom, but I don't think he stops breathing, forget it. If they snore loud enough to be an issue where people have to change bedrooms, or they've got to have some sort of screening, go talk to the doctor, do something. You can't just say, my husband just snores, because they can't. The wife's going to be asleep some of the time, and he might just jerk. I mean, it's not clear that they stop breathing for 10, 15, or 20 seconds to an unsophisticated observer. Now, a lot of them will say, yeah, I think he stops breathing, and I have to shake him. But if you're snoring really, really badly, you got to go to your doctor and talk about it.
Yes. No.
So what
ditto and ditto, because it's just so hard. I mean, people have edged into this. They're just not one day where they suddenly start doing this, so everybody gets alarmed. No, this has been going on for years. And then there are the people like me that are, they have what's called central sleep apnea. Their brain just quits breathing.
Well, what if you, and we'll get out of this, because what if you get up in the morning and you say, man, I slept great last night, and your wife looks at you and says, you snored all night long, but to you, I slept great last night.
Sure
not saying that was me.
Okay, but basically, people don't have to have an elevated blood count. They don't have to have early afternoon fatigue. But people who say they get sleepy when they're driving, and they get sleepy after lunch at work and stuff, a lot of those people have got sleep apnea, and they don't know about it. Right. So anyway,
all right.
There's something.
I had a couple more. Yeah, I know the second question.
Go ahead. You got another thing on sleep apnea?
No, I would like to say thank you, Georgia Cancer Specialist affiliated with Northside Cancer Center.
Yeah, we're paying the bills.
Okay, so.
This, I have actually talked to this. I was able to make contact with this.
So you were on the phone to China yesterday?
No, to the brother.
Oh, to the brother.
Okay, to the questioner. My brother is in China.
Oh, I got it.
In China, just diagnosed with Waldenstrom's lymphoma. They want him to take chemotherapy there for 6 weeks, and then he can come home for treatment. What do you think? Well, I was able to determine that this patient is really sick, and not just has the diagnosis, but is sick, really sick. I also found out that he's in a hospital in Szechuan, China, and I wanted I'll go over Waldenstrom's in just a minute, but people criticize China with the Wuhan virus and everything else, but I've been to China 3 times. The first time I was in China in 1982, there were only 5 cars in China owned by private citizens, and everybody rode a bicycle. And I can guarantee you that China today is so much far beyond us in technology. Their cities there with 30 million people got 8 perimeter highways. Everybody owns a cell phone. Well, the Chinese cancer community, many of them were trained in the United States or in Great Britain or in really top-notch places. They do a tremendous amount of research and publish very good research, and they're able to do it because they don't have all this informed consent we have that handicaps them. So I happen to know the hospital that he's in, and I have been in conferences with the doctors that are treating him. He's going to get great care in China. And when they said 6 weeks, I know exactly what they're going to treat him with, because the cycles are 2 or 3 weeks long. It generally is going to take about 6 weeks to get him in some sort of shape where he can come back home, and home for him is Canada, by the way, and get treated. So let's quickly go over Waldenstrom.
He may be better off in China than...
He might be better off in China.
Well, I was thinking the same thing. If the treatment is good, why try to move the treatment? Unless he may just want to be home.
Well, think about it.
To be home.
Okay, I'm going to tell you, I hate to tell you, but the treatment's going to be CHOP-R. And you know CHOP-R because your mother took CHOP-R for 6 cycles, right? Mm-hmm. That's 6 cycles of every 3 weeks, and that's 18 weeks of treatment. And CHOP-R is the induction therapy he's going to get, and your mama would have rather have been in Pennsylvania than in China.
Got it.
Okay.
You answered that very clearly.
Okay, show the first one. Waldenstrom's macroglobulinemia confuses the issue here. Got that up there? All right, take that down and I'll talk about it in a minute. Waldenstrom's macroglobulinemia is a production of a gamma globulin. Myeloma, remember, monoclonal gammopathy, uncertain significance, we've talked about it for a time. The Waldenstrom's macroglobulinemia is not IgG gamma globulin, it's IgM, which is a big molecule. Now, that makes the blood a little bit like honey. Doesn't circulate well. The viscosity gets very high. Can throw you into kidney failure, can make your brain, liver not work because the blood's not flowing very good. And it would be terribly unsafe for that guy to get in an airplane with very thick blood. His is so severe that they have done 3 plasma exchanges on him in a week, which means that they took out all of his plasma and replaced it with blood bank plasma just to get this soup out of his blood. So throw that first one up there. So the macroglobulinemia can be mild, like Muggis, where you don't do anything to it, or it can be bulky and profound like he has, and be sick as a barking dog with very much hyperviscosity. He'll pull that down now, Emily. But that's where he is. He's in the far right-hand end of this Mayo Clinic guideline thing here. Now, we're going to talk about the treatment just a minute, because frequently the treatment for Waldenstrom's macroglobulinemia, if it is low, is watchful waiting. All right, well, it ain't for him. Pull it up very briefly. What they're going to do, the standard used to be big-time chemotherapy. We now have a whole bunch of new novel agents. This guy is going to get CHOP-R, which is old treatment. You can pull that down. He's going to get old treatment because what's the advantage of old treatment?
Tried and true.
Tried and true, and very rapid in its effect. Whereas these new agents that are sort of genetic blockers are less toxic. You don't lose your hair, doesn't drop your blood count, but they take longer to work. So he'll get that treatment. He'll get that treatment for 6 weeks. Assuming that his blood counts are pretty good, he'll probably be bald by then. He'll be coming back to Canada. Maybe make him isolate himself for 2 weeks, but they have good cancer treatment in Canada. So I am of the opinion that he has the right people taking care of him there. It is totally unsafe to put him on an airplane and bring him home right now. And I have great confidence in the oncologic treatment and the oncologic community in China. They are well trained. They use the same drugs, and I'm not the least bit. I wouldn't be not their politics, but if they make a cell phone, I probably use it. And
Bill, what would they look for? What will they monitor on him to say, okay, you're good to travel right now?
Viscosity. If
and they do that how?
It's a blood test on the plasma.
I think, because my question is...
That's a rocket scientist.
Viscosity is a big thing.
I'm just pimping him.
Viscosity is a big thing.
My question on why come home, because my concern is, you're 100% right, you want to be home. I firsthand seen what happens and what you go through. So you want to be home, but I also know your immune system.
Yes.
That's where my travel and immune system is like, we were advised, and I put it like this, we were advised with my mother, okay, you can't just have, my mom and dad always had the house where you just come in and everybody visit. I mean, everybody in the neighborhood visit. We had to gingerly ask people, don't do that.
That's correct.
Don't, you know what I'm saying?
Yeah,
so that's my question on that.
But that's because in mid-cycle she had no blood count.
Right.
Okay, now what they're going to do here at the end, I guarantee he may not come home in 6 weeks. In 6 weeks, he might be halfway there or 2/3 of the way there.
They're going to try to make it happen.
Yeah, but you remember, I think they did a scan on your mother after 2 cycles and after 4 cycles, and she was making progress. So that's what they're going to do here. He might take a 3rd cycle. But once they let him go home, he's going to go home at the end of a cycle when his blood counts are normal. And they're still going to have him wear a mask, not a COVID mask. He's going to be wearing that mask for something else. He will fly in first class, and he will be placed in a seat that does not have a companion unless there's a nurse or a person.
And he'll probably be in the very front of the plane because air moves front to back on this.
So there'll be there's a time, there's a window of opportunity.
Yes, and there's a mechanism.
And when they get there, that's when they'll.
Correct. And there's a mechanism for transporting patients who are illness like this. It's done all the time. People on dialysis or people going from a burn unit. They go first class in Delta. They'll block off a place. They may have to pay for 8 seats and take a whole. But airlines are very capable of taking people across the ocean who are fragile and need medical care.
All right, you want a fun fact about viscosity?
Yeah, go ahead. Fun fact about viscosity. Okay, sure. Didn't know there was a such thing, but let's go with that.
So in aerodynamics, the drag is related to the speed by a cube. So you have to cube the speed in order to find out what the drag is going to be. A race car takes, ones that go really, really fast, a couple thousand horsepower. Use that first 1,000 horsepower to get up to 180, and then you use the next 1,000 of horsepower to get from 180 to 230. That's because by the time you're going that fast and you're cubing it, you're like driving through water. The air is like water.
Did you see that thing about that Bugatti car that ran 300 miles an hour? I saw that car with my eyes, I told you.
When that car is going at its max speed,
320 miles an hour it went.
Oh, yeah. That's probably molasses. I mean, it's taking that much.
Was that the fun fact?
Yeah.
I just wanted to make. I didn't want to miss the. I'm sorry.
Nerd talk.
I did not want to miss the fun fact.
Listen, we got important stuff here today.
All right. News in the news.
Okay. Well, the news is going to bring us to the COVID.
Okay. Got it.
All right. The third item on the news of the week. Can you please read that with your glasses or without it?
Coronavirus lingers. No, I'm not reading that. I refuse to read that.
Coronavirus lingers in penis and can cause impotence. That's the third thing in the list today, and it was on the news yesterday. And that is one of the things that will probably be used to try and stimulate the males who have not had the vaccine to take the vaccine. Now, as Dr. Tidman
intended to stimulate, right?
Yeah, as Dr. Tidman quite pointed out, there were only 2 patients that were in the series.
Yeah, a case study of 2, but they're going to get some attention with that one.
But it was compared to 2 people who didn't have it. So anyway, that took care of that. All right, I wanted to show this.
Only you. Go ahead.
Yeah, okay. I wanted to show my little graph I had here just a minute ago. That shows here are the
3.7. I know exactly what number you were looking for.
I understand. All right. I understand.
Okay.
The PCR test rate in Georgia now is 3.7%, and even Dr. Napoleon up in Washington told us that when it was below 5%, you were in pretty decent shape. Well, you remember 4 or 5 weeks ago we were at 4.8, then 5.1. This is the lowest that it has been. Now, Georgia has more counties than any state in the country. How many do we have?
159.
159. 54 of our counties are in a rapidly falling rate in terms of new positive tests. I'm not going to say cases. Positive tests. 78 are totally flat, and 24 are rising a little. But Fannin County had 1 positive test this past week. 1. And no deaths.
It's my patient. He's doing fine.
It was just a test, though, right?
It was just
the guy wasn't sick.
Yeah.
Now, the other thing that I find interesting is, Fannin County's had 2,384 positive tests. They call it deaths, and they call that cases, and 72 deaths. But there are 2 different figures out today for the number of total cases in Georgia. The Georgia Department of Public Health has 888,000 cases with 18,000 deaths. The other source of information has 1,100,000 cases and 20,000 deaths. Now that's 5%.
That's some messed up numbers.
That's 5%. Yeah, that's messed up numbers. Well, and Ray and I read every week this. We get a blog from a PhD that we read, trying to dissect out the numbers. And this poor woman has been doing this for 16 months. Always says, but George is reporting this, and the U.S. Public Health Service is reporting that, and Johns Hopkins is reporting this, and the New York Times is reporting that. At the end of the day, what I want to say is every marker of the COVID epidemic is going in the proper direction. We had said, you heard it first on FetchYourNews, we said here in the end of January, early February, or certainly March, that mask is not protecting us against anything. We're wearing it for social reasons. Now they're trying to tell us to immunize kids down to 12 years old. It is my opinion that immunizing kids down to 12 years old has been shown statistically and by research to be safe. I don't think they need to do that. I'm of the opinion that they need to immunize the teachers if they want to be immunized, and let these kids go to school, and don't shame their parents into making them have a shot or stay home. That seems to be where it's going to go. That if your boy or girl has not had their vaccine, they're going to have to stay virtual and they can't come to school. I just don't want to see that happen. I don't think they need to be immunizing these kids and making them feel bad. Immunize the teachers. Let the kids go to school. I'm shutting up now.
Go ahead.
It's heartbreaking the way that our public health service is running things. I mean, it's as though they will not look at the data, and they will not take feedback, and they will not move off of zero. And these children should not be masked at summer school. 3-year-olds should never have a mask on their face. There is no.
Oh, don't do that. Don't do that. I just flying home.
Oh, yeah.
Okay, flying home. I'm sitting in the airport, and every 5 minutes, it is federal regulation that you must wear your mask at all time, blah, blah, blah. So I'm going through the airport. First of all, I struggled not to walk up and say something to somebody. So I was sitting there the whole time saying, don't say anything, don't say anything. So people sitting there with the mask down on their mouth, I want to go up and say, would you please put that over your nose? Or just take the damn thing off. Oh, shouldn't say it, right? But I wanted to, you know what I mean? But I
Can you bleep that?
Yeah, don't say anything, don't say anything. So there you go. Now, this lady's coming down through here. She's got this little girl, 3 years old, about 3, and 1 in a stroller. And all 3 had masks. And I'm going like this. Just keep reading your book. Just keep reading your book. And
well, they've been scared to death. I mean, they've been told if you don't wear the mask, Godzilla Bacter's going to get you.
I hate to tell you, but I saw a baby. I couldn't have been over 6 months old at the Ingalls yesterday in a stroller. I mean, probably 9 months, because sitting up pretty decently, and had a mask around the face, but the mask was hanging out here like this. I mean, if you I won't go by masking up my 6-month-old.
But let me ask you this one question, because we got to get out. We have our pet. Yeah, we have our pet here today. But let me ask this question. So the CDC says, okay, you have the vaccine, you don't have to wear a mask. All right. To me, I had my vaccinations, go to school. Is COVID-19 really something that has to be on that vaccination chart?
No.
To go to school?
No.
Is it
there are
really,
schools that are going to try to make it happen.
Right, but is it really something? I mean, are we going to say in America, your kids can't come to school because on their vaccine chart?
There are people planning that in colleges.
That's exactly. Colleges have already done it.
Yeah.
But we don't have to take a MERS shot.
I understand mumps. I understand. There's a list. I understand.
MERS and SARS are both COVIDs. We had epidemics of both. That's not required. Now, COVID was just huge different. I'm of the opinion that this is going to be burned out in a year or two. and
be gone.
Well, they'll be gone.
I don't want to get into, and like I said, I got
but not much.
I got to get out, but I don't want to get into like anti-vax. I'm not, but there's people that are saying, why? There's something about the why factor here. Why are they going to force our children? Why are they paying us?
Let me tell you what the why factor is. They're not explaining it. Like I started the program with, if you give somebody the why, they can figure out the how. Most Americans are bright. They can do that. That's what they live their life doing. You give them the why. They don't give you a why. They give you a rule.
And
then when you challenge them and ask them about that, they just get all huffy and say, well, listen, we have to think really hard about these rules before make these rules. How dare you ask me? That's not an acceptable way to be in America, as far as I'm concerned. You give people the why, you inform them, they figure out the how, they come back to you, they say, hey, my how that I figured out is costing me a lot, or it's really hard on me, or it's a lot of conflict.
Or it was easy.
Or it's easy. And then you help them adjust. But you don't just tell people this is what you're going to do.
So, rules that say vaccinate your kids or we can't open school, you agree or disagree?
Disagree. I just got this saying. I said, don't.
I know. Just one.
I just don't. I don't think it's mandatory that kids get vaccinated. And I do believe that if Mama wants her 12-year-old to get the shot, fine with me. I mean, but I don't believe that they should make the other mama feel bad, or that I'm worried about the 12-year-old who didn't get the shot.
Well, now it's 12 to 15, and I'm like, I don't know if we should rush our 12-year-old kids to get this.
Look, kids are bullied, right? I mean, if you're fat or if you got a stutter or something, they're bullied. Now they're going to be bullied because they haven't had the vaccine. I mean, that's got enough things that kids to be different about and be bullied about. I don't like it.
Final thought?
Well, final thought is along the COVID thing and along school. There's an immense amount of psychology in the faces. Yeah. We grow up, the baby grows up looking at mother's face. That before he's communicating or she's communicating, he's studying her eyes and her mouth and wrinkles and everything. That child is first learning from mother's face, okay? Mothers who have their face covered up, the child, he's getting a part of the information. That cannot be good. But that goes through all of life. We go through life as children. We look at other kids. They're happy. They're smiling. They're running around. We see their face. Faces are important to read. So when they came out and said, just wear the mask, it's a patriotic thing to do. I'm like, no, it's stupid. It's stupid. It's taking away people's information. You have to show me that mask does something really, really meaningful before I take that information away from people. That's it.
We want you to go work on that little fun fact thing, and maybe we'll spin that into an entire show, like
we can talk more about velocity.
Dr. Tidman, the science guy, or something. Right. You want to do that? Okay. All right. Thank you.
All right, so
Dr.
All right, one more time. Every marker of the COVID epidemic is going in the proper direction. You got your mask off. Go out there and live your life. Donate blood. Go see your doctor, get your mammogram, have your colonoscopy, and quit fretting and let the kids go to school.
All right, folks, thank you very much. Georgia Cancer Specialist affiliated with Northside Cancer Center. Don't forget, you can always watch these segments on our YouTube channel, Ask the Doc, but go to FYNTV.com. Ask the Doc. He has his own page on there. You'll see his picture, Northside Hospital, all kinds of information. And all of these segments you can share with your friends on FYNTV.com. Ask the Doc. I love these guys. I appreciate them very much. They come here every week and share information, great information. Thank you very much. Things are a little different. We got about 10 minutes with our Pet of the Week over here. So we're turning things around. So if you're waiting for the All-Star Political Panel, they'll be up at 9. They're ready to go. But we're going to have our Pet of the Week.
And it's a cute pet.
Huh?
It's a cute pet.
I love this dog, but it's like I don't know he's been on a major diet.
Oh. Damn.
So, yeah.
34 pounds
he's lost 34 pounds. We're going to show you this pooch right after this. Thanks, guys. You got to get to work.
Don't get self-conscious about this now.
Let's get out of here. We'll see you right after these messages.